Namaskar and welcome to Apollo 24/7's Health Hour. Today we are going to talk about joint health, the bone and joint health, which is very important for our mobility. As we invite our expert orthopedist, Dr. Tathagata Das, onto the show, I would love to tell you that today's show is going to be interesting. You can ask all your questions and queries about bone health and joint health and arthritis. I'll take up the questions, and Dr. Saab will answer all the questions to you. And also, there is a health quiz coming up. I'm going to ask you 3 questions, and you can win prizes from Apollo 24/7. And do stay with us till the end of the show, where we are going to give away discount coupons. And I'm going to announce a special Sunday offer for Apollo 24/7 Circle members as well. So, before we dive into our show and before I invite our guests for the day, let me thank all of you on behalf of Apollo 24/7. Apollo 24/7 has successfully completed its 1 year, and this couldn't have been possible without you and me, actually. I'm also a part of the proud 6.5 million plus patrons of Apollo 24/7, and we are in this together while being a part of this beautiful journey to transforming healthcare. Apollo 24/7 promises to continue providing us with the superior healthcare services of the Apollo healthcare ecosystem. As a token of appreciation, Apollo 24/7 is giving us this extra special offer because they've just turned 1. You can consult an Apollo specialist, a doctor, today only at rupees 1. Yes, you have heard it correctly. Only at rupees 1, you can book an appointment and consult a doctor. The offer is valid only for today, for rupees 1 only. How can you do this? Scan the code which is on the screen. You can see it there. Or there is a link which is in the chat box of the YouTube. You can scroll down and find the link. Click on the link or scan the code. You will reach the page where you can book your appointment and consult the doctor. This is valid only for today. So please use the code DOC99. Share the good news with your friends and family who require these special doctors. Offer valid on select doctors only. When booked today, that is 7th February, and consult only on today, that is the same day. Congratulations to Apollo 24/7 for turning 1, and looking forward for much more transformation and getting the healthcare system closer to audience like me. So let's invite today's specialist. Our expert today is an expert orthopedist, Dr. Tathagata Das, who's a senior orthopedic surgeon at Apollo Gleneagles Hospital, Kolkata, who has more than 24 years of experience. His special interest is arthritis care, joint replacement, arthroscopy, trauma, spine surgery, and he has performed more than 3,000 joint replacement surgeries, who's actively involved with a special counseling center for trauma and fracture afflicted patients, who's worked at prominent hospitals in USA and Scotland prior to joining Apollo Hospitals. It's a privilege and honor to introduce Dr. Tathagata Das. Namaste, Dr. Das. Welcome to the show.
Good morning and namaste.
Good morning. So it's been a very, very happy Sunday and a special Sunday. Having you here on this special occasion makes it even more special, Doctor.
Thank you.
So I hope you also have been consulting on Apollo 24/7.
Oh, yes.
So how has your experience been?
Oh, it has been very helpful in these, lockdown times, because a lot of people are still scared because of the pandemic. It's still there. So, many of my patients, they don't want to come and visit me in the outpatients department. So they are greatly helped by this platform. And another thing about this platform is there are hardly any glitches in this platform. It's very flexible and versatile. So I'm very comfortable, and my patients are also very happy with the platform.
Wonderful. Thank you so much. And it's been a pleasure for me of having a great platform of interacting with experienced doctors and bringing it to common audience. Because it's very rarely that you find a platform where you can answer these questions. So let me start with bone and joint health, doctor. See, bone दिखता नहीं है, तो joint जब तक वो हिलता नहीं, तब तक हम उसको बहुत easy ले लेते हैं. So when do you think one has to understand that bone or joint is giving me a problem? What are the signs and symptoms that one has to look out for?
Well, to start with, the bone system, the skeletal system, is basically the framework which holds the body together. We are able to walk, move around, do our activities of daily living just because of this bony structure. And if anything goes wrong with this structure, then the whole system gets upset. Now, to talk about the bone health and the symptoms and all that, what happens is whenever we have weakening of these bones, say there is a condition called osteoporosis, where the bone density, the calcium in the bone, it decreases. It can happen with age or many other diseases also. So here, because of the weakness, inherent weakness in the bones, a lot of pain might appear. And that is one primary symptom, pain. Whenever you have a pain, then you are alerted to something going wrong. So pain is there. And then after that comes, the mobility.
Okay.
And when you talk about mobility, then it is again the joints, because motion appears in the joints. That is where it happens. So whenever there is some kind of pain in the joints, then you start thinking that probably there is something wrong with my joint. And there now you are trying to think about arthritis. So which is again an affliction of the joint. So this is how you come to know that, yeah, there is something wrong with my bones. So
Right.
the patients should try to take a call right then.
Okay, so arthritis is related to joints. So how are joints affected, and how can one understand what arthritis is? And as I understand, arthritis में काफी तरह होते हैं, many types of arthritis. So does age bring on arthritis for sure, or can I prevent it as well?
Well, you see, arthritis is the affliction in the joints. So what happens is here, every joint is protected by a cartilage. Now, it is a kind of tissue which is layering the joint on both the sides of the joint, if it's a two bone joint. So what happens is this cartilage layer, which protects the joint and the underlying bone from rubbing into each other, it gets eroded. Now, this erosion can happen because of many reasons, age being the most common. So with age, what happens is, say, about 80% of people over the age of 60, 65 will have these kind of age-related arthritis. It might be symptomatic, it might not be symptomatic, but the process continues in the joints. So it is basically the वो जो cartilage जो होता है, वो बोन के जो कवरिंग जो है वो निकल जाता है, और उसके बाद जो होता है हड्डी के साथ हड्डी घिसती है और दर्द उसी से होता है. Yes, it starts rubbing the bone. When the cartilage rubs against the cartilage, there is no pain. But the moment the cartilage is gone, हड्डी के साथ हड्डी रब करने लगता है, then you have the pain.
So is there a way of preventing this, or is there a cure?
Well, see, arthritis is a problem which, as I told you before, that 80% of people will have arthritis at some point of time. Say. So the thing is, it is inevitable. It is going to come. For some, it comes earlier. For some, it comes later. Now, what is the trigger that you bring the arthritis later? So what you have to do is concentrate on the healthy lifestyles, which is very important. Controlling your body weight. Obesity is again a very harmful thing, and it causes loading on the joints. You just think about a situation where a person is given, say, 10 bricks on the head and asked to walk 1 mile. So it will be very painful for that person. So now just think about the situation where this person is walking with 10 bricks for 10 years. So it is like disaster for the joints. That is exactly what happens. Now, so you have to keep your body weight to
balance.
In balance. And well, again, one thing that is quite intriguing to a lot of people, that why exercise? Why don't you keep it at rest? See, if you keep the thing at rest, then it stays perfectly all right. But no, that's a myth, because the more you move a joint, the cartilage regeneration happens.
Okay.
So if you move the joint, and in a joint, there is the cartilage and there is a fluid called the synovial fluid. Now, the synovial fluid is basically nothing but a lubricant.
Right.
Now, when you talk about a car engine, what happens? If there are only metal parts, then the engine won't work. You put in some lubricant, some mobile. So what happens then? It lubricates the parts, and then the parts work perfectly. Now, in the joints, if you move the joint, synovial fluid gets created. It
अच्छा, it
gets
gets
manufactured
created there. It's not
inside
like
the joint.
वो खत्म होता है कि इसलिए
No,
मुझे चलना नहीं है.
that is what happens. If you keep the joint at rest, then the fluid doesn't regenerate. So once you have the fluid, keep the joints moving, do the exercise, your cartilage is also healthy. So that
So
way
this is
you
like
can,
that murgi or anda story.
yeah, something like that. Yeah.
So you have to move to keep your joint healthy.
Oh, yes.
It does not move, then you are not healthy. So it's like
Yeah. So
painful.
movement is very essential.
Right, I understand. I am exercising very well. For somebody like me or age group where we are conscious about health, weight,
Yes.
and exercise, is there something else that we also need to take care? What are the do's and don'ts for a healthy joint?
As I told you, body weight. So you need to keep the body weight down. The comorbidities like diabetes. So diabetes is a debilitating disease. Now it causes harmful effects for all the systems in the body. So it
Right.
also creates problem with the bone and joints. And again, you have gout. Say
Uric
जो
acid.
गठिया बताता है, गठिया बात. So here what happens, it is a uric acid which rises in the joints. Now, if the uric acid rises, so what happens, small crystals are formed in the joints and they cause erosion in the joints. So, you have to take care of your diet so that you don't, eat things which can cause this kind of situation, like, too much of red meat and things like that, high protein diet. So, and, stay away from alcohol or alcohol in moderation. No, you should avoid smoking and these things. So, this is what you do about the diet and all that. Exercises should be, targeted exercises, especially, you should concentrate on isometric exercises where it's not the movement that is important, but you strengthen the muscles by, applying some force on it. So you do the exercise against resistance. So these exercises, help the joints to regenerate and stay good. So more or less, these are the things that you can do. And over and above that, nowadays, what happens is if you have arthritis, the early stages of arthritis, where you're having a slight pain or something like that, a little bit of discomfort, then there are a lot of medications which are available, which actually help regenerate cartilage. So you can consult your doctor, and the doctor can prescribe medicines of that type, which will actually take you through this regenerative process.
This is sounding interesting, doctor, because the medicine is improving every day, evolving with the new kind of research is coming up. Earlier, arthritis, बोलो तो घुटना निकालो, फिर नया घुटना डालो. Replacement was the only option, I suppose. Now that you're giving us some hope with medication, if it is detected early, right, doctor?
That's right. That's
What
right.
tests one has to understand and get done, and how
So
frequent?
you see, the basic test is an X-ray. Now, what happens in the X-ray? What we see is we see the bone as white, and everything else is black. So now, if you just think about it, what I spoke just a few minutes back is that, at the end of the bone we have the cartilage. So now I said that bones looks white. So what will the cartilage look? Black. So if it is if there is a cartilage, then it will show as a black line between the two bones which forms the joint. So say this is one bone and this is another one. So there will be a gap like this. Now, if in the X-ray I see that this is like this, so it means that there is no gap. So what does it signify? It signifies that the cartilage is gone. So when you see that, you know that arthritis is striking. So that is the primary thing. Apart from that, we also go in for a blood test, wherein you look at things like what I said, uric acid, the level of the uric acid, whether it has gone above the maximum permissible limit. Then again, you have the diabetes, and also along with arthritis, which I am talking about, is osteoarthritis. You have other types of arthritis also. Say,
Right.
there are something called rheumatoid arthritis. So in rheumatoid arthritis, again, there is a rheumatoid factor in the blood, which rises above the normal level. So then you know that the patient is suffering from rheumatoid arthritis, which is again a different kind of arthritis, and you have got to treat it that way. So
Right.
basically, these are the things. And then again, like if you want to do more, then definitely there's the MRI, there's the CT, and there's a host of other things. But the basic thing is an X-ray and a blood report. Yes.
Okay. So one quick question from my side is that अगर किसी को age related आता है and then if pain is not the factor but creaking sounds होते हैं या that this is the time that they have to start, what kind of exercises do they have to get in and how do we motivate one to start? Say my.
Oh, well, exercise, as I said, the joint is not only two bones and the cartilage in between them. A joint is basically a composite thing where it is encapsulated within a capsule, and then there are the muscles around it, the ligaments around it. So what one has to do is strengthen the muscles so that the balance is maintained. So this is very important. Now we see very commonly people walking on the roads with their knees, that looks like a first bracket. So it's like bent
Correct.
inwards. Yes, like
Bent.
this, like this.
It's like this, huh?
Now that person was not born like that. It was straight. So how did this happen? So this happened because of uneven loading. So the muscles on this side is probably weaker, and that's why it's collapsed. So this side is good, so it's holy. So these are the things. So that's why a balance has to be there. And so the muscle balancing is very important. So one needs to do exercises to strengthen the muscles. So in it, there are the exercises can be isotonic, where you have the movement, or isometric, where you hold it and then you try to push it. So
like body weight and resistance.
yeah, resistance.
Resistance.
So both the types of exercises has to be done, and that way you can achieve this thing. And particularly where the arthritis is striking, say if you have an arthritis in the knee joint, then you have to do exercises which are around the knee joint. So probably the physiotherapist will be able to advise on what exercises should be done for that particular joint care.
Wonderful. So let me start the questions from audience, doctor. There are a few questions which are from the pre-registered users as well, and there are some live questions. You can also, audience who are watching the show, you can, if you have any query, Dr. Tathagata Das will be very happy to answer the questions. So please type your questions and queries in the chat box. The first question I see here is, how do I improve or retain my knee health as I'm getting old and I have a history of uric acid for last 20 years? Shweta is asking this question.
I couldn't hear the first part of it.
How do I improve or retain my knee health as I'm getting old and I have a history of uric acid from 20 years?
Okay, yeah. So, well, yes, here we are actually touching on that uric acid thing, which I was harping upon, before. So, what one needs to do is you keep your uric acid at a proper level with medication and diet and all those things. And once you keep it in the proper level, you'll see that the problems because of the uric acid, there's the acute joint pain and redness, swelling, all these things will not come to you. Now, once you take care of that, so uric acid won't be a problem for you. And now when you talk about arthritis, which again progresses with age, there again, do your exercises, keep your body weight under control. I think that way you can strike the balance and you'll be absolutely fine.
Wonderful. That's nice, doctor. Next question is from Naveen Tulabandhu. Is stem cell therapy, will stem cell therapy work for stage 3 osteoarthritis?
Well, stem cell therapy is still now in the nascent stage, so a lot needs to be seen about how it comes out. So it's very difficult, to give, opinion at this point of time. So we are all waiting and watching what happens. And definitely we're very hopeful that some good things will come out of it. Yeah.
Yes, thanks Naveen for asking this question because this is something very new and we have to still wait and watch. Because experts are here, people would want to listen what an expert opines, right? Doctor, next question. I think both the questions I'll club together. Lalita and S. Koshi, both of them are asking about ACL rehabilitation. One is asking about how was the success rate of ACL rehabilitation, and the other one is asking, is Koshi is asking, is it possible to treat ACL tear category 1 without surgery and just regular physiotherapy?
Yeah. So if I talk about the first question, is ACL reconstruction, the process, if done properly, is a very rewarding thing. The patients who suffer from ACL tear after surgery and rehab, they go back into active sports. So now the rehab has to be done very properly. What happens usually is whatever you do inside the joint. Now, be it a small procedure or a big procedure, in the sense that normally what we do is we do ACL reconstruction through the arthroscopic method. So externally, you see small little buttonholes, but inside a huge job has been done. Now, when you fiddle with the joint, what happens is the first thing that happens is you have an inflammation in the joint, and then you have restriction of movement, you have pain. So rehab can be very painful, but it is the determination of the patient. So that is where the patient's own willpower comes into force, the determination to be good and come out absolutely fine. So as a doctor, I can give you a good ACL reconstruction, but coming out of it into proper active sports and active life, you have to do your part also. The physio will definitely help you out, but the physio can't do the exercise for you. So it is you who have to do it. So once you do it properly, you will do very well. Now, taking the next question, that is the grade 1 tear. What happens is, as I told you before, that the joint is related to the muscles. Now, with ACL, what does the ACL do actually? ACL is a ligament. It's a very fat, thick, strong ligament which connects the tibia to the femur. So in the knee joint. Now, if the ACL is not there, it's deficient, then what happens? The tibia, it slips on top of the femur. So rather,
and femur being the largest bone.
Sorry?
Femur is the largest bone, I suppose.
Yeah. So what happens is there is an instability in the knee joint. So if you start walking, then your knee might wobble. Now, so essentially what it does, the ACL, it holds the two bones together. What does the muscles do? The muscles also actually span a joint. So they also do the same thing. The ACL does from inside the joint. The muscle does from outside the joint. So now, if you think about it, say your ACL is a little deficient and your muscles are very strong. So the same work can be done by the muscles. And if you don't go into active sports, then the activities of daily living, like walking, going to the market, climbing upstairs and down, it's perfectly all right.
Right. So physiotherapy can help to that extent.
Oh, yes.
To next level of activity, physical activity, then you might have to consider, right, doctor?
Yes. But for a grade 1 tear, usually it heals. It heals normally. If you go to the major tears, then possibly you'll have to think about some kind of arthroscopic procedure of reconstruction of the ACL and physiotherapy after that. So that is how you look at it.
So according to you, the grade 1 tear can be given some more time.
Oh, yes. A little bit of conservative thing can be done, definitely.
Okay, wonderful. Before I get into next question, which related to bone and joint, जामियन हक पूछते हैं, लोकल लैंग्वेज में ट्रीटमेंट करवा सकते हैं क्या अपोलो 24/7 पे? वेस्ट बंगाल का पेशेंट बंगाली में कंसल्ट कर सकते हैं अपोलो एक्सपर्टीज के साथ? डॉक्टर तथागता, what would you say?
Well, I am a Bengali, so I can speak in Bengali.
हिंदी आप उनको बंगाली में आंसर दे दीजिए, he'll be very happy.
আপনি নিশ্চয়ই চিকিৎসা করতে পারেন। হ্যাঁ, কলকাতায় যারা ডাক্তার এখানে চিকিৎসা করছেন তারা সবাই বাংলা ভাষা জানে, বাংলায় কথা বলবেন, আমরাও বাংলায় কথা বলবো, এতে কোনো অসুবিধা নেই। এরকম না যে আমরা ইংরেজি আর হিন্দি ছাড়া বলবো না, বাংলায় কথা বলবো এবং বাংলায় বাঙালির সাথে বাংলায় তো কথা বলবো, তাতে আপনি ভালো মতো বোঝাতে পারবেন আমিও বুঝতে পারবো, আমি নিজেকে বোঝাতে পারবো আপনাকে, তো কোনো অসুবিধা নেই, নিশ্চয়ই ফোন করবেন, কথা বলবেন।
Sounds so perfect and so beautiful. It's such a wonderful language.
Bengali is a very melodious language,
Very melodious language. And definitely, while choosing the doctor on the Apollo 24/7 app, it is important to see where the doctor is coming from. And it makes it easier for the patient and the doctor to converse in the language that they are comfortable to.
Yeah, actually, that question comes, I think, in the
Yes.
beginning, that whether you are comfortable in English, Hindi, or the local language. So there, it's sorted, I think. Yes.
Right. Thank you so much, Dr. Das, for answering that question. And next question is again for ACL reconstruction. Lalita's question is ACL reconstruction is done 12 years back for left knee. Latest MRI shows normal, but off late few times while walking, sudden jerk happens, followed by pain for some time. Is it okay?
Well, if the MRI shows a normal ACL, then possibly the ACL is perfectly all right. Now, if the jerk appears, it could be for many other reasons. There might be a tear of the cartilage. So again, the cartilage tear, what happens is it could be because of the injury. So I presume that if it was because of the injury, then it would have been treated at that point of time. So it was not there. So cartilage tear can appear with age also, which is degenerative. So the cartilage, it loses the water content, dehydrated, gets dehydrated, and it might fray. So that is a age-related problem. And what happens if you have that? Then also it might cause clicking and some kind of jerks and all those things. So you need to get yourself checked up, whether you have got something like that or not, or maybe if arthritis is striking you or not at this point of time. So a host of things are there. I think it's better that you consult somebody who will be able to guide you through the whole thing.
Okay, that's interesting. Next question from Tech Wong. Hello, doctor. My right thumb has been swollen and the joint is not working, giving pain on touch. Nowadays, the pain is continuous 24/7. What is this?
If I could get some more specifics, it would be easier. But then taking the question from where it is, I would say that the thumb this is the thumb, and that you can have a pain here, you can have a pain here, you can have a pain here, wherever you can have a pain here. Now, I would generalize the question and and give you the commonest answer. So usually what happens is you have a pain here at the base of the thumb. Now, this is what we commonly call the triggered thumb. Now, here what happens is, the thumb, every joint is moved by the muscle, as I told you, and the muscle ends as a tendon, which is, a rope kind of a thing, which binds the muscle to the bone. Now, this movement is caused by pulling. The muscle is pulling the thumb down. Now, this is a tendon which goes and attaches out here. What happens is there are, the sheets over here which don't let the tendon slip out here and there. So it has a path. So the path is maintained by sheets. What happens in this condition is, due to arthritis or any other reason, there is thickening of the sheet or thickening of the tendon. And so the tendon doesn't pass smoothly through the sheet. And that's why the moment you do this, you have a pain where it passes, the obstruction. So, if you have this kind of situation, then definitely you need to do some exercises, do some movements and all that. And sometimes a shot of hydrocortisone in this local area, anesthetic, it helps, it takes care of the pain. So, if you have that kind of a situation, maybe you should consult somebody and pinpoint the diagnosis and treat it accordingly. Yes.
Right. That's very, very well explained, doctor. Thank you so much. It was very clear to understand the moment. Right. Next question is from Shweta Kareddy. How to fix arthritis for 70-plus-year-old? It is very painful and she is afraid of surgery. She's seen many failed cases and difficult to convince her.
Well, now, if the patient is 70 years old and she has arthritis, now how long has the patient been suffering? So if I think that the patient is suffering for the last 10 years. Now, 10 years the patient was not sitting idle. The patient was trying all kinds of things. As I talk, so are other orthopedic surgeons also talking and performing. They are also doing the same things, and they have advised her to go through the physiotherapy, reduce the body weight, do exercises, take those medications, and all those things have been tried and done with. Now, if that doesn't work, what does the patient do? Because there is nothing more in the basket. So it's all done. I presume that is the situation. So in this situation, if the patient needs a knee replacement, it has to be done. As far as these things are concerned, that the fail cases, if there is one fail case, there are more than 100 cases which are doing good. So it's always good to look at the brighter side of everything. I think that thing helps. And normally what happens, the patient is not in a position to decide. At the age of 70, it is our parents or our grandparents. What happens when we are children, our parents take care of us. So they make the decisions. When we are talking about our parents, then they are always scared. It is quite normal. So it is the children or the grandchildren who should explain to them that, Dada, कोई प्रॉब्लम नहीं है, दादी कोई प्रॉब्लम नहीं है, देखो ना ये करा के आई है, हाँ एकदम बढ़िया चलती है, आपके मॉर्निंग वॉक में आप जाते हो, देखो कितना सुंदर चलती है वो, और आप डर रहे हो, क्या हुआ, कुछ नहीं होगा, you'll be absolutely fine. Bring them to the doctor will do his part, counsel the patients. I personally give all my patients who come and who are scared to do the surgery the telephone numbers of the patients who consent to be spoken to, who I have performed surgery on. Right. So it is always better to talk to somebody who has gone through the procedure done by me and is doing fine. Right. So that is a moral booster for the patient. So I think something like this can be tried, and maybe he will consent for surgery. And the best thing is the joint replacement surgery. It is such a rewarding surgery. It's one of the most rewarding surgeries these days, and it gives excellent results. I've got patients, and I've got those videos of patients how they were walking before and how they walk later. And when you do that, it's a remarkable change. It's tremendous. So I think that will help. Yes.
Yes, doctor. Next question is Meenu Arora. How important is it to take calcium and vitamin D3 for arthritis?
You see, calcium and vitamin D, these are essential for the bone health. Now, usually what happens in women around the post-menopausal age, there is depletion of calcium from the bones. Now, here, calcium supplementation is very, very important. It's good to have calcium supplementation and vitamin D if the vitamin D level is less. Now, what it exactly does, it strengthens the bone. Now, as I told you, the bone is the basic platform on which the joints and movement and everything is, revolves around. So once you have a strong bone, then automatically your body is strong. So calcium intake helps strengthening the bone. But when you talk about joints, then again, your exercise, keeping your body weight down, and blah, 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 all the things that we talked about. That's how you look at calcium.
Yes. So Sangeeta Singh, I think your question is also answered, because she's asked, can we have Shell Cal HD on regular basis? So it answered the question of many of about calcium and D3. Next question is Anil Kumar Sharma. मेरा भी ये question है doctor आपको. Which food increases synovial fluids? Are there any foods?
No. There is no such food which increases synovial fluid. So it's not like I take olive oil and we have oil out
there. Lubrication ho gaya.
No. That doesn't happen. It is normal food that you have. But again, you exercise the joints, keep the joints mobile, and the synovial fluid will be generated by the synovial membrane. So there are cells which secrete the synovial fluid, and it will automatically come. Definitely.
Right. So आप चलते रहो और synovial fluid बनाते रहो.
Yes.
Right. Ashok Talwar's question is slip disc problem curable in case of a 70-year-old lady?
See, Ashok, slip disc is basically a mechanical problem. Now, what happens is between the two vertebra, there is that disc. which is essentially a cartilage kind of thing. So because of any kind of reason, be it injury or age, as I presume in your case it would be age because she's quite old. So then if that thing comes out and the symptom is a pain which radiates down the leg, if it is the lumbar spine, if it is the neck, then maybe the pain radiates down the hand. So it is caused because of a mechanical block. Now, if there is something blocking the nerve, then automatically no amount of therapy or whatever can cure it. I will give you an analogy. Say it's your tap, and then what happens is there's a lot of deposition of iron inside the pipe. What happens? The water flow, it decreases. So this is exactly what happens with the nerves. Now, if there's a small little piece of cartilage or disc material which is pushing that nerve, creating a mechanical block, then it will create that pain sensation because of that block out there. So until and unless that block is taken out from there, it cannot be solved. So if she needs surgery, it has to be done because again, the results are miraculous. If that pain is because of a slip disc, that small little fragment, the moment that fragment is taken out, she will thank you immediately post-operative because the pain will just magically disappear.
Oh, okay. So, डरना age के हिसाब से नहीं है. You have to take a call according to the situation, which is the problem which is persisting.
Right. And of course, comorbidities again. So with age, there are a lot of comorbidities. So surgery is a major thing. So one needs to be very careful about that, take care of the comorbidities, and then go into surgery. So,
well, doctor, I had actually seen one of the pre-registered question. I can't see it right away, but I remember कि अगर कोई diabetes है और उनको surgery, knee replacement surgery की ज़रूरत है, can they go ahead or will the wound pose some problems because of diabetes?
a very interesting thing. This is something a lot of people ask.
Yes.
Now, diabetes is now more or less a lifestyle disease, you can say. Many people have diabetes. So, and the point is, diabetes is not a contraindication for surgery. When you think about it, a person who has diabetes, shaves regularly. There are small scratches, cuts. It heals. So usually, I ask my patient, does it take time to heal? I say no. And then why will it take time for your knee replacement incision to heal? It won't. So what we do in practice, if the patient has got diabetes, I would ask my diabetologist colleague to take care of the diabetes part before surgery, during surgery, after surgery. And so that is taken care of and I do my job properly and the patient gets a very good result.
So diabetes को पहले control करो.
Yeah.
And simultaneously जो भी है आपको surgery करवाना है करवा लो.
Yes, right.
Rima Kendry's question comes next. How to increase bone density post 60 in women? 60 years plus.
Yeah. So here again, to increase the bone density, one has to go for supplementation, that is calcium supplementation. There are a lot of other molecules also which are there, which help increase the bone density. Something like bisphosphonates, these are a group of drugs which actually help increase the bone density. And again, there is teriparatide injection, which is a hormonal injection, parathyroid hormone. It also has shown very promising results in patients who are using it, particularly in this age group. And they have been greatly helped by that. Along with that, keeping the body weight under control for them also. So if normally it happens that the patients, the normal individuals above the particular age, and especially in our subcontinent, what happens is with the dietary habits and all that, we eat a lot of carbohydrates. So, and that's why the body weight tends, you have central obesity, the tummy. So these things have to be kept under control. Some very basic exercises has to be done because you can't ask a 60-year-old person to go and do something in the gym. No. So basic exercises So that I think yoga is a very good thing, stretching and all that. So these things they've done, I think that can take care of the bone density part. Yes, it can.
Wonderful, doctor. Thank you so much for answering the question. And next question is from Virendra Kumar Jain. Parkinson disease affected people. What is the exercise that you suggest for foot movement and stepping?
Parkinson's disease again, it's a neurological condition, and what happens is basically there's tremor out there. So one has to be very careful that the patient doesn't fall. So prevention of fall is very important. So always there should be somebody by the side of the patient and during the exercises, and exercises that too, it should not be again too much of a heavy exercises. Isotonic exercises, movements of the joints, yoga is just perfect for that. Yes.
Wonderful, doctor. Next question is Sunita Bahuguna's question. Is there any cure for hypermobility for knees?
I could get it. Can you repeat?
Hypermobility for knees.
Hypermobility for knees. If she's talking about the joints being more, you know, there's a condition where what happens is the joints, they are very loose in the sense that, say, there are some people who can make this thumb touch here.
Yeah.
Right.
होता है काफी लोगों का, हाँ.
Yeah. So that is hypermobility of the joint. But that is a congenital condition, and you really can't do anything about it. It's just that you strengthen the muscles around that joint, and so that way you kind of create an atmosphere where you are fine.
Wonderful. Next question is Sujata Chopra. Can surgery be avoided with exercise and massage of knees?
As I told you, that exercise is cardinal. It's very, very important. And definitely if one sticks to an exercise regime, then maybe you will not have arthritis at all. You will not have any symptoms at all. And massage, what it does is it basically increases the blood flow. And when it increases the blood flow, it brings in the good things into the joint and the adjoining areas, and it drains out the toxins. That is the lactic acid, which causes pain and all that. So that way massage helps, but it is a short-term measure. But exercise in the long term helps keep the joints very healthy.
Okay. Doctor, there are two questions which are very generic. Ramya Nagraj asks, low back pain hai, to precaution like gel, spray, hot water, will they help? And TP Karmakar asks, turmeric or haldi powder, can that be taken for knee pain? So these are all those general things that we all do. Some pain आता है तो कुछ तो घर में कर देते हैं पहले. How well and effective are these?
See, when there is a chronic pain, definitely applying some hot compress in that area, it helps. It helps, the soothing the pain sensation. And these gels, they also have got molecules which take care of the pain. So they actually help. About haldi and chuna, I don't have too much of an idea about that, but I've seen the grandmothers, they whenever you get hurt, you apply haldi and chuna. So, well, I think Ayurveda, somebody could enlighten more about that kind of.
Okay. Rupi Goel question is, I had injury on both the knees. It remains straight from 7 months, but side by side bones are not built. Is it mandatory to go for bone grafting so that the bones will regenerate and bending problem can be solved? I'm not sure if I posed the question right, because exactly वही word से question आया है. I hope you understood the question.
If you could just repeat the question.
I will. I had injury on both knees. It remains straight from 7 months, but side by side bones are not built. Is it mandatory to do bone grafting so that bones will regenerate and bending problem can be solved?
Okay. As I can visualize, he had an injury. So probably he had a fracture around the knee joint. And because he had a fracture, maybe some kind of surgery was done on that fracture, some plate application or whatever it is was done. Now, 7 months down the line, he cannot bend his knee. And the doctor has advised bone grafting. Now, if you break it down into parts, what has happened is during these 7 months, possibly he has not done good physiotherapy. It was definitely painful because he had a fracture in the joint. And the physiotherapy was possibly neglected. And that's why he had that stiffness in the knee joint. Now, again, bone grafting, the other part of the question is because the bone is not healing, or maybe there's a gap. So the doctor has advice for bone graft. So what will happen is the bone graft will take care of the bone being healed, the fracture being healed. So that will take care of the healing part of the fracture. And as far as the stiffness in the knee is concerned, that has to be done through physiotherapy. And if physiotherapy fails, then possibly some kind of surgery by lengthening of the muscle or anything of that sort can be done for him to restore the knee function.
Okay. Next question is, I'm sorry, Kavish Raghav. I have recently undergone elbow surgery, terrible triad. Your advice on how to get back maximum elbow movement?
Well, exercise, 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 exercise. That's it. So what you have to do, see, elbow joint is a notorious joint. It is one of those joints which even a small little scratch happens in that joint, it behaves very badly. It goes into stiffness and you have tremendous restriction of movement. So the only way you can overcome that is exercise. It is definitely painful. I can assure you it is very painful to do exercise the elbow joint, but there is no other way. And again, if you do proper exercises, it will come back to normal. But you have to start very early, because what happens with very little time, the elbow gets stiff. If 6 weeks, if you don't do exercises, it will get very stiff, and then it becomes really, really, really very difficult. And I can assure you this much, that if the elbow becomes stiff and the arthrolysis or another surgery which loosens the elbow is done, then also you will be in the same position wherein you will again have to do exercises to get that elbow moving. So you can't get away from exercises and the pain which comes with the exercises. So that is the package that you are in. So you have to go through the whole gamut of things, then only you'll have good movement. Exercise, 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 and exercise. That's it.
So listening to your advice, मुझे तो अभी सचिन तेंदुलकर गॉड दिखते हैं, क्योंकि वो एल्बो के साथ ऐसे कैसे गेम खेले हैं. So exercise is the magic.
Yes, yes, true.
ठीक है. Next question comes from Meenu Arora. How to differentiate between arthritis and fibromyalgia? My doctors are confused about the diagnosis.
Well, arthritis, again, as I told you, it's a disease afflicting the joints. So what happens is the cartilage is eroded and you have pain in the joints. Fibromyalgia is a very complex thing. It is very diverse in the sense that it affects a lot of areas all over the body. So there are trigger points in fibromyalgia, where you have pain in the shoulders, in the back, in the shoulders, in the scapular region, in the knees, in the lumbar spine. So these are basically more of a muscle pain. And again, fibromyalgia, a strange thing is that it is also very much linked to the psychological aspect of the patient. So there is a psychological axis in the fibromyalgic pain. So where a lot of people, when they have stress, any situation which triggers stress, you start having pains out here. So that is what fibromyalgia is. And arthritis is a total disease of the joints and caused by erosion of the cartilage. So this is the basic difference between fibromyalgia and arthritis.
Next question, Dr. Ramanjanelu is asking, my wife Mandakini is 64-year-old ailing with rheumatoid arthritis since 10 years. Despite diet and other controls, ESR levels are not coming down. Any remedy?
Well, rheumatoid arthritis, again, it's a very difficult disease, and it stays on for life. Now, what happens is, eh, one can have flare-ups. That is something you can't avoid. So again, medication, exercise, and the diet and all those things keep it at bay. Uh, there are certain drugs which are used these days, the biologicals. So they kind of they offer a cure to this disease, but that is still there are gray areas, and it's still being tried and all that. So the thing is, well, you can definitely consult your rheumatologist if they prescribe you with this kind of a drug. Then definitely you can go and try that.
Right. Doctor, one last question. There are a lot of questions remaining. They can be consulted again. They can come back to you. But one,
It will take a lifetime.
yeah, I know, doctor. But this is one important question I thought should be addressed. Ajay Jazua. I have hemophilia, and due to continuous bleeding in joints, the cartilage has eroded completely in one of my knee and elbow. I do workout and physiotherapy. I'm just 29, and knee replacement is suggested. What do you advise?
Well, hemophilia again, and the bleeding in the joints. There again, those the hemosiderin granules and all that, they cause this erosion. All that it's very kind of very difficult situation, and especially at this early age. Now, what I would say is that uh, if it is so debilitating that you can't move around, it's incapacitating you, then it is better to go for a joint replacement. At least, the productive years of your life, you can have a good life. There are patients who not this condition, but who suffer from a vascular necrosis of the femur at a very early age, wherein the femoral head melts, kind of thing. So there also they are incapacitated. They can't walk. They walk with a limp. That they have deformity in gait. Now, what do? They have to go in for a hip replacement, maybe at the age of 25 or 26. But then they have to go in for it, and with very good implants that are coming in these days. What happens is, before we used to have those first generation implants wherein they would last for about, say, 5 to 7 years, and then you have to do a revision. But nowadays, with advance in science and the metallurgy and all that stuff, the implants that are coming in are very, very resilient. They can last for up to 25, 30 years, or even more than that, because there are people who are continuing with these kind of implants for the last 30 years, and they are still continuing. So you really don't know whether those implants will continue for 40 years or maybe 50 years. So it is always good to go in for a good implant, and then continue life that way. Use your productive years to do something good, and you'll be happy.
Wonderful, doctor. Doctor, as I'm running short of time, I'll have to close questions, and there are a lot of questions and queries. Dr. Tathagata Das can be consulted on Apollo 24/7, and he's available at Apollo Kolkata Gleneagles facility, and he can be consulted there in his clinic as well. Doctor, thank you so much for your time. But before we wrap up, I want you to give us top tips on bone health and joint health.
Well, as I told you, that the most important thing is to keep your joints mobile, not to lead a sedentary life, and you have to keep a tab on your diet, good healthy diet, not those fast food and all that stuff. Moderation, alcohol, smoking prohibited, and these kind of things. And along with that, you have to keep your body weight down, and uh, try to be cheerful and happy. The mental state is a very important thing. It is the mind which controls a lot of things. So if you can do all these things, I'm sure you'll have a very good and healthy life and healthy joints.
Wonderful. Thank you so much, Dr. Tathagata Das. It was great pleasure interacting with you, and you have wonderful patience to explain in detail to the patients. Thank you once again. Namaskar.
Thank you. Namaskar.
Thank you. So that is about joint health, and he can be consulted on Apollo 24/7. You can consult him, and also I would want to be reminded that it is Apollo 24/7's anniversary, the first anniversary offer. Consult selected doctors for ₹1 only for today. So if you have already seen, the link is there in the chat box. Please go ahead, click the link, or find it on Apollo 24/7 app as well, and make use of this wonderful offer. And here I am with your questions. Health quiz के लिए तैयार हो जाइए. Asking you 3 questions. You can answer the questions, type the answers in the chat box. Towards the end of the show, I'm going to declare the winners, and the winners will have to write back to us to Apollo marketing at apollo247.com. It's on the screen. You can see that. And gift vouchers will be shared with you. Get ready. Question number 1 मैं पूछ रही हूँ. Which part of the adult human body contains most number of bones? Which part of the adult human body contains most number of bones? समझ में आ गया ना? अगर समझ में आया और आंसर पता नहीं है, गूगल करो और आंसर टाइप कीजिए. Quickly go on, type the answers. I am checking the live. नहीं, आंसर मुझे अभी तक नहीं आया है. Grid gauge, foot, head. हेड में ज्यादा बोन्स नहीं होते हैं. बैकबोन. अरे रे रे, आई एम वेटिंग फॉर द राइट आंसर. Anil Kumar Sharma, you got it. Hand is the right answer. Next question. Question number 2. Name the longest bone in a human body. Which is the longest bone in the human body? आज की डिस्कशन में उसका we have also mentioned it. If you have followed the discussion, you will be knowing. Otherwise, फिर से check कीजिए और आंसर टाइप कीजिए. Name the longest bone in the human body. Reshma Mariam, you were very fast. Aa gaya hai. And next question, the third question, the last question for today. Which tab or which button in Apollo 24/7 app is needed to tap to access your prescriptions and lab reports? कौन सा बटन आप टैप करते हो तो आपके अपोलो 24/7 ऐप में प्रिस्क्रिप्शन एंड लैब रिपोर्ट्स आते हैं? Which is that one button? Please type what the answer is. And that's the last question before I wrap up and before I announce the winners. सर्कल मेंबर्स के लिए स्पेशल संडे ऑफर मैं अनाउंस करने वाली हूँ. गेट रेडी. इट इज अ संडे एंड एवरी संडे बिकम्स स्पेशल फॉर सर्कल मेंबर्स. So tap for a Sunday surprise. Buy medicines today. Anywhere that is through Apollo 24/7. If you buy medicines, you get a pack of 30 refreshing wipes worth 80 rupees at no cost. That is free of cost. You're going to get a refreshing wipes ka pack at which is worth 80 rupees. Use the code APWSUN. Use the code APWSUN, and that's it. That's a special offer for circle members this Sunday. All right, let's see who the winners are. The winners are Anil Kumar Sharma, Divya Sehgal, and Sushant. Congratulations. You are the winners and you have to claim your gift by writing to us at marketing@apollo247.com. And thank you all for joining us. Here are the gift coupons. Use the coupon Apollo247 to get up to rupees 299 off on online consultation with Apollo doctors, and use coupon medicine10 to get 10% off on pharmacy orders. Log on to Apollo 247 app to use these coupons. Thank you so much for joining, and please take care of your health. Keep moving for a healthy joint, and we shall be coming back with more information. Please take a minute to write to us back and give your feedback. Thank you once again. Namaskar. See you next time.